Direct access is the ability of consumers to access physical therapy without the referral from a physician. So the Health Provider Service Organization states there's no increased risk to patients who see physical therapists direct access versus those who have a referral. So a little bit of history. As of January 2015, all 50 states, Washington, D.C., and the U.S. Virgin Islands have some form of direct access to PT services. This is regulated at a state level, which means the state government determines the direct access laws and regulations. So it differs between each state. So here is a chart that kind of shows you that difference. So you can see the three different colors. If you look at this, you see that blue states are unrestricted states. That means there's no restrictions to direct access services to PT. The red states have provisional direct access, which means that you can get PT direct access, but there are restrictions. And the green states are limited direct access, which means that direct access is only available in extremely limited circumstances. So if you consider throughout the United States, from most strict to least strict, you would look at green, red, and then blue, blue being the least strict. So what is the law in Indiana? It states that direct access services for 24 calendar days, starting the day of initial evaluation. So that just means a patient can go to a physical therapist, get the evaluation, and then can be treated for up to 24 calendar days after the initial evaluation. After 24 days, if more physical therapy is needed, they would need a certification signed by a physician. The providers that could certify a plan of care include a physician, a podiatrist, a psychologist, a chiropractor, a nurse practitioner, or a PA. So also stated in the Indiana law is that physical therapists must have a referral prior to performing a spinal manipulation or sharp debridement. These cannot be seen direct access. So if we consider the three big factors of healthcare, access, cost, and quality, direct access plays a positive role in all three of these. So if you think of access, direct access makes healthcare more accessible to people. Going and seeing a physical therapist first makes more access. You don't have to jump through the hoops and go see other providers. And it increases an individual's choice in their healthcare. They can choose if, hey, I think I have a low back strain, I'm just gonna go straight to PT. I don't have to go see my physician prior. So then if we consider cost, direct access decreases the overall cost of healthcare. So a study referenced by the APTA compared groups of patients that came to PT with direct access versus those who came via physician referral. So those who came direct access had overall had an average lower cost of $1,543. So they saved that much money by going straight to PT instead of going to a different provider for referral prior. And they had no adverse events that occurred when comparing these groups. So then if we look at quality, direct access improves the quality of healthcare. It shows that there's higher satisfaction and better patient outcomes when a patient comes direct access. So a 2014 systematic review stated that patients going to PT via direct access had higher satisfaction rates and better overall outcomes at discharge. So what's the daily impact of direct access? So direct access is more utilized in private outpatient practices. It allows PTs to be responsible for the clinical decisions. They don't have a physician that's dictating what they're allowed and not allowed to do. They don't have an MRI to go off of. They don't have an X-ray to base anything off of. They are responsible for the clinical decisions being made. Direct access allows for patients to utilize more cash-based services. If you're having kind of an insurance problem or you've hit your max out of pocket and you can't use PT anymore, you can utilize direct access and pay for it via cash-based services. Also, the CDC recommends physical therapy as an alternate therapy for the opioid treatment, which is really big right now. We're in an opioid crisis, and so it's big that patients can come to physical therapy. So what role does direct access play on management? Certain facilities require a referral and do not utilize direct access at all. A lot of hospital-based settings are this way. So if you're in management, you may start to consider if direct access is a route that they should go and kind of get rid of that referral first rule. It also plays a big role in marketing. A lot of people don't know that physical therapy can be the first line of defense in healthcare, and so marketing can get the word out there that you can go to the physical therapist without having a referral from your doctor. And then insurance payers. There's so many different insurance payers in the U.S. and so many different plans that it's important that we know if a patient tries to come direct access and they want to use their insurance, some insurances may require a referral prior, and that makes direct access not an option. So pre-certification is very important when it comes to direct access. Then there's Medicare. So Medicare patients can come and see physical therapy without a physician referral, but Medicare requires that the physician certifies the plan of care within 30 days of the initial evaluation. So they don't have to see the physician. However, it's unlikely that if a physician hasn't seen the patient in, say, 6 months, they're going to certify the plan of care without seeing them. So it is an option, but it's not the easiest option for Medicare beneficiaries. So then what does direct access look like at Optimum Performance Therapy? So OPT is connected to Lutheran Health Network, and it receives a huge referral base from FWO. So even though many referrals come from FWO post-surgical and people who are having some other issues that aren't surgery necessary, but PT will help, direct access has increased recently in the past year at OPT. Patients who have a visit limit per year, say you tore your ACL, you have 20 visits, well, you need to continue physical therapy for, say, 6 months, this is definitely an option. And you can also utilize cash-based.